Okay, what we're going to do here is we're going to have a summary of the types of connective tissue, and then we're going to have a little quiz. So first, let's describe the 8 main points we discussed about connective tissue. First, loose or areolar connective tissue. This is the delicate thin layers between tissues, and it is present in all mucous membrane. And this is of course different from the dense connective tissue. An example of dense connective tissue would be in tendons or ligaments. Then of course there's adipose tissue, which is fat, and hyaline cartilage. Hyaline cartilage can be found in the nose and the ends of long bones or in the ribs. How about elastic cartilage? We can find that in the outer ear and the epiglottis. And fibrocartilage. Fibrocartilage, as you remember, does not have a perichondrium. That's one thing to remember about that. But where do we find fibrocartilage? Between the vertebrae, knee joints, and pubic joint. And then bone, which is of course the skeletal system, and blood, which is in the bloodstream. So let's have a little quiz here. What type of connective tissue would you find in the tendons and ligaments? That is dense connective tissue. What type of connective tissue would you find in the nose and ends of long bones or ribs? That's hyaline cartilage. Where would you find elastic cartilage? In the outer ear and epiglottis. What type of cartilage is between the vertebrae and knee joints and pubic joint? That is fibrocartilage. And how about the delicate thin layers between tissues between all which is present in all mucous membranes? This is loose or areolar connective tissue. So think about the location, and you'll do well.